Have you ever come across an exam hall or after giving a GT, and when you're reviewing the answers, you have felt that the negative markings, what primarily you have got, is not because you don't know the subject. It's primarily because most of your guesses what you made went wrong. I'm sure most of you must have been in this place. And if you have been that, and if you're struggling to get out of that, this video is for you. I'm Dr. Ranjith, your pathology faculty at PW Med, and if you've still not yet subscribed to PW Med channel, click on the subscribe button and let's learn how to avoid silly mistakes in an exam. The most important topic which I wanted to talk for a very long time. I've got a few questions from students. I'm going to look at these questions and also try to solve them in between, right? So let's get back to the video. The first and the foremost thing is people keep saying right from your school days, never do guesswork, do an honest work. I am absolutely for it. But at the same time, that statement of never guess is absolutely wrong. So first we have to unlearn what has been taught to us through the entire school and college work. It's not never guess. The biggest myth breaker is make an intelligent guess. That's very, very important. And we're going to see how to make an intelligent guess across all the 19 subjects, so that if you're writing an FMG exam, this video might help you to inch towards the 150. And if you're preparing a NEET PG exam, this might save you from missing a negative mark. And I'm sure you know how important a negative mark plays in a final exam, right? So let's go ahead. We'll take a few examples and we'll see one by one how to eliminate options. Before even going to that, I want to divide the questions to 3 categories, because you need to know where to apply guess and where not even try to guess it, right? The first category of question, you look at the question, you know, this is the right answer, click it, don't do anything. That's like your absolute golden buzzer. You know the answer, you write it, you come out of it, that's all. The second category of question is like, you read the question, you're either not even getting the question, I don't know where it is coming from, or you don't even know any of the options. Something which is in very foreign land, like an out of syllabus. Don't even try to guess it, because the probability of guessing that is definitely very, very, very low of getting success answer, right? So ignore that. That's the second category, right? The third category is where you know the question, but you're struggling with what's the right answer. You know the question, you know the topic, you know the subject, but not able to get the right answer. That is where the elimination strategies, what we're going to see, is going to help you, right? The first strategy. See, medicine is never about absoluteness. What do I mean by this is, you must have seen questions which says that which of the following statements are true regarding some random disease. Always presents with fever. Never a probability. Medicine is never ever about absoluteness. Please do remember them. Always is not true. Never happens. Like for example, a side effect. Never associated with insomnia. This always and never is almost always impossible in medicine, because medicine is never about absoluteness. That is very, very important. So this is one of the simplest elimination you can see. Looking at the question, okay, 100% positive, 100% negative. I'm going to rule them out because I trust medicine and not about the NEET PG paper here. Medicine is never about absoluteness. Do remember them. That's a first trick. The second thing, let's say, for example, you're going with a subject like pharmacology, where the drug is asked and you have side effects of them, right? So let's say XYZ drug has all of the side effects except. So you can group them. Like for example, bradycardia is one, hypertension is one, GI disturbance is one. Now if you see bradycardia, hypertension, right, kind of having the similar cardiovascular problem, right? And GI is something which is an alien. I'm just giving an example. So if you have things which can be grouped into a particular system and there'll be an odd man out, that's an easy way to eliminate. Generally, when I as an examiner want to kind of frame a question, we'll give very close options and the last one will be an outsider. That I want you to pick it up. That odd man out you can easily and comfortably eliminate. I just gave an example. Like this, for every options, you can group something. Okay, these are all under one system. Might be the right. This is something which is very, very alien. Might be wrong. You can eliminate them, right? That's the second clue. The third strategy to eliminate options, this will be applicable for every scenario-based question, especially in the clinical subjects like medicine, surgery, OG, pediatrics, ortho, anything, right? Simple. See, when you have a scenario-based question, for example, let's cook up a question, right? A 23-year-old female came with a history of something. Age, gender, history can easily help me eliminate few things. A 23-year-old female coming up with some findings, very, very unlikely to be cancer. Yes, you know that for a fact, obviously, right? Okay, 45-year-old person presenting with so-and-so disease. Very, very unlikely to be an autosomal recessive inherited condition, right? I can eliminate. You can easily eliminate. A 75-year-old person having this finding, most likely to be cancer, right? So because there are categories which can help me, okay, this is more positive in that favor, right? That's a very, very useful clue for almost every scenario based question and in the clinical subjects. Please look for them, right? Please remember, toppers don't do the guesswork based on the memory. Toppers do the guesswork based on the clinical probability. Remember this and write this in front of your desk. Toppers make a guess based on the clinical probability, not just toppers. When you go out and you start seeing patients, you make a probable clinical guess. You don't make guesses based on memory, right? So please read the question. You can easily eliminate one by one option. That will be a very, very, very good source for you to eliminate few things. Got it? Right. Next, the fourth one. If it's a numerical value, okay? If it's, let's say, T half of a drug, though the amount of questions which has been completely numerical and completely factual is reduced a lot, thanks to the exam pattern, it's becoming more clinical and more comfortable for us. If at all, if a question comes which is completely numerical, again there will be one which will be very outside. T half of the drug is, okay, 12 hours, 20 hours, 25 hours, 500 hours, right? Something is very odd, kind of eliminate, right? Though this probability of you getting the question itself is very, very less because our exam pattern has totally changed to scenario based question, right? This also is a very good probability for me to eliminate an answer, right? Let's take one question from a student. Let's see what the student is asked, and we'll go and talk about them. Okay, perfect. This is a very interesting question. So because most of the questions as per the student says that what is the next probable step? You must have also seen, right? So you have a clinical scenario. What do you do next, right? Here is where I want to say there's a trap of sophistication comes inside. Whenever a next probable step is asked, one of the options will be like do a genetic study, a mutation analysis, a functional MRI, PET scan, right? This is sophistication problem. This is a trap of sophistication. So what happens here is generally a student by default thinks like that. Or let's say, what's the most common diagnosis? What's the most probable diagnosis of this patient? There'll be one syndrome. Patient with hemoptysis. What's the most probable diagnosis? So-and-so history is there. There'll be one option like Goodpasture syndrome. Your brain will go for that because that's a trap of sophistication. Please get out of that. You have to get into the common goals. You have to get into the common shoes, because I had a professor who said that 95% of the time, something which you diagnose rare is always wrong. That is a reality, right? So come back to commonality. Put yourself in the shoes of the examiner or a physician. You are sitting in OPD. A person comes to you with fever. You won't think of familial Mediterranean fever, right? That's what I want you to think in the exam also. Think as a physician, think as a doctor, not as an entrance solving question robot. This will eliminate huge number of mistakes. A very, very good question from the person. Observation, medical management, surgical management, then all the hi-fi things. That's how the order, what you must have practiced in your OPDs, the same thing should be applied in the exams as well, so that you can avoid and escape the trap of sophistication. Got it? Let's take one more question. So here, this is a very common thing, right? The most important part, the two option rule. The student says that, sir, I'm able to eliminate of the 4 2 easily by whatever so-and-so strategies. I'm stuck with 2. What do I do that? Right? This is a golden trap. So most of the time, when you solve a question, you know that, okay, this is not right, but I don't know what is these two, of these two. I always trust basic instinct. There's something called a gut instinct or a spinal response. If someone is going to throw you something, right? You don't tell, okay, this nervous system stimulate, sympathetic, parasympathetic, your spinothalamic, this, and then stop it. No, you immediately stop it. That is a spinal reflex. Spinal reflexes are with good amount of memory, experience, which is stored in your mind, brain, which you don't know it exists. The same way reflexes do work in exam also. You have studied for 4.5 years and a year of internship, and then also you have studied for entrance exam. You have good amount of memory. Your brain knows stuff, but unfortunately we only say that we forget things. So when you see an option, when you're stuck in this golden trap of 2 options, Whatever your brain or your instinct says, this could be the right answer, go with that. Trust me, trust your brain. It knows how to process things at a pace, at a perfect level than you can ever perceive it. You will have an instinct. You cannot explain how it is, but you know that, okay, this most probably will be the right answer. Go with that, and most of the time that will be the right answer. If you don't trust me, I want you to apply this in a GT and see if your instincts work. I won't call them instincts, I would call them your 4.5 years of work in the MBBS college and an amazing 1 year of internship and your entrance preparation. All the consolidated memory is giving you the clue that this is the right answer. And please try to avoid changing the answers, because most of the time changing the answers will end up in having overthinking. You go into the loop of overthinking, you end up in marking the wrong answer, right? These are two things what I want you to tell to escape the golden trap, right? Perfect. Okay, that's all. So before we finished, I want to say a few things. Never change answers without a solid reason. Always think like a common man. Don't fall into the trap of sophistication. When you have a golden trap, that's two options. Go with the instinct. It's not your instinct, it's your years of hard work which is telling the right answer. Medicine is never about absoluteness, and I'm repeating once again, toppers don't make guesses based on memory, they make guesses based on clinical probability. If you have any more doubt, put in the comment section. Let's discuss about that and see you soon. Till then, bye bye from Dr. Ranjith. Bye bye.